We've shown you the state of Florida also seeing an increase, 2,900 cases now. Dr. Christie Alexander has been joining us throughout this COVID-19 outbreak to give us the latest information, really to answer a lot of your questions. She's joining us again today. Dr. Alexander, first of all, thank you so much for being here. Nice to see your face again. We had you on the phone the last time.
Yeah, and Doctor, we wanted to start with how are you doing and how's the medical community doing?
We're doing okay. Statewide, it's a different story, but here in Leon County, so far we're doing okay. Luckily, we don't have as many cases as there are in other parts of the state, but we really have rallied together as a medical community, and it's been really great to see.
Oh, that's nice to hear. Doctor, there's been a lot of measures that are being taken by government officials in an effort to flatten the curve. At this point, where are we on that curve, and are we seeing success?
Well, I will say that we are still on the rise of that curve. If you remember what it looks like, there's a steep rise and then it falls, and we're still on the rise. As of 11 o'clock this morning, there were over 94,000 cases of coronavirus across the nation and 2,900 cases in our state alone. So unfortunately, we are still on the rise of that. We have now surpassed Italy and China in the number of cases in the United States. And as far as whether or not our efforts at flattening the curve are working, it's really too soon to tell, because in some areas we're not seeing that much of that many cases, whereas in other areas such as New Orleans and New York, for example, we're seeing a lot of cases. So it remains to be seen whether our efforts at flattening the curve are working or not.
A lot of people already getting antsy about the amount of time that they've spent indoors as we practice this social distancing, and a lot of stay-at-home orders have been issued. There's been talk about lifting restrictions in the next week or two. Easter has been a popular date people have highlighted. Do you think that that is realistic?
Well, until we see that curve coming down on the other side, the short answer is no, because we don't know. We need to continue social distancing until that happens, until we come over on the other side and we start to see less and less cases. And we don't know when that's going to happen, unfortunately. We would all love to get out and get away from all of this social distancing stuff. But in the meantime, we don't know if it's going to be a week, 2 weeks, 4 weeks, and we don't know. Easter is sort of an arbitrary date at this point. So unfortunately, it's hard to say.
Okay, and Doctor, major cities like New York and Los Angeles are already getting outside help from the government with naval hospitals that are being docked at their ports. We've heard that medical professionals are coming out of retirement to help out at hospitals. Yep. Do you think that support is going to be enough?
Yeah, hopefully it will be. As a matter of fact, we're very, very hopeful that it will be. You're right. I was going to make that point too. That's great about the medical professionals that are coming out of retirement to help with this. They're even advancing medical students and getting them prepared to help with this as well. So nationally, I think it will help, yes, if we all band together and do that as a nation. I'm hopeful that it will. Yeah.
And in addition to that, I have to ask, do you just feel like you're wearing a cape right now? Because, I mean, so many in the medical profession have been doing all they can, working these crazy hours. I know we asked you how you're doing at the top of it, but, I mean, what sort of pride do you kind of feel with the fact that you guys are all banding together to help figure this thing out?
It is a 24/7 profession at this point. Not that it wasn't before, but it definitely is now. We are all on webinars and conferences and on the phone, and how can we help each other, and it's nonstop. So yeah, I mean, it's what we do. It's what we're called to do, and we love doing it, but we just hope that we can get ahead of this thing before it gets ahead of us.
Okay, so, and we just saw some video from inside some labs, and obviously treatments, that's what people want to know about. We've heard about a malaria drug that some say may be effective. Is there any scientific evidence behind that? And do you think that we're moving closer to finding something that might work?
The answer to your question is no. There is no scientific evidence behind that, unfortunately. I wish there was, because we'd be all running to it right away. We are trying everything right now. We're looking at that combination of medications, the malaria drug along with the azithromycin. We're looking at Somebody talked about plasma transfusions. People are talking about zinc. There's so many things that we're working on, but none of it has the data to prove it yet. Right now, we're just in those stages of trying to figure it out and trying to get that scientific data to say, yes, it's okay to use these drugs or use this or that treatment. And in addition, the problem with the hydroxychloroquine, which is the malaria drug, and azithromycin, in combination, they can cause a really, really dangerous arrhythmia of the heart that can lead to cardiac arrest and sudden death. So these things aren't without their complications either, which is why we're trying to do this quickly, but also being realistic about the treatments that we're using.
And Dr. Alexander, talk to us about the people in our local community at your clinic. Are the patients that are coming in, are there a lot, like, is there an influx of people who are afraid they might have COVID-19?
Absolutely. And the more this gets real for Leon County, the more calls we get, the more people that are wanting to know if they can be tested, things like that. We are lucky. We've done a really good job of jumping on the telemedicine bandwagon quickly. So we've been doing a lot of our triaging on the phone and through the computer. Being able to diagnose people that way has been really, really helpful in keeping the community safe. And I think our entire community is embracing that, which is good. Entire state, actually. I was just on a webinar call about it last night. We are seeing more and more of that. And the ability to say, okay, I'm standing in our ambulance bay at our clinic right now. We have it set up so that if we needed to come outside and test somebody or look at somebody to keep them from coming inside, we can. So we've taken those measures immediately to keep our community safe, but still treat those that need it.
Okay, and just to reiterate while we have you live here, what should someone do who might be at home and is fearful they're starting to feel ill? What should they do?
People that should feel, okay, so if you feel like you have, again, the three symptoms are fever, cough, and shortness of breath. And fever is anything over 100.4. So if you feel any of that, and you're really struggling to breathe, if you feel any of that, call your physician, call an urgent care center, call the ER, and see if you should either come in and be seen, because it might be something else. You might need to be screened for the flu, or should you go straight to one of the testing centers and get tested?
And I think that's where some confusion, or some people, okay, I'm feeling this certain way, maybe I have the temperature. So you should probably make that call first. You shouldn't just go.
Right.
That's what you're saying?
Yes.
Okay. We touched.
Absolutely. Make the call first, because we can make that screening over the phone, and if you meet the certain criteria that qualify for testing, we can send in an order and have that done for you.
Alexander, we talked about this last week, and it was about the shortage of medical supplies and medical gear that doctors across the country are having to deal with. What are you hearing, from your colleagues? What are you experiencing personally, and has anything gotten better since we talked about this last week?
It's definitely very real. It's definitely a national problem. Personal protection equipment we just don't have enough. I'm still using the same mask that was issued to me about 3 to 4 weeks ago now. That's how short we are on equipment, and it's a big problem. There are centers across the country that are manufacturing things quickly, and even outside of the country. So we're hopeful that some of this equipment will start trickling in very, very soon. But as it stands right now, what you're seeing is real. People using bandanas as a mask and things of that nature, that's very, very real. So we're trying to come up with alternatives to that as much as we can until we get more equipment. And again, to the community, if you're not sick, please save those masks for somebody who is, or somebody who's in the healthcare field who needs to protect themselves from getting sick.
All right.
And just for a point of reference, how often normally would you be receiving and using a different mask?
Great question. We would be changing our mask with every patient. So usually when I go in and see a tuberculosis patient, for example, in the ER, I'm using a different mask with each encounter with that same patient. So every time I walk into the room, I'm using a new mask. So you can imagine having one mask for everybody you see for weeks on end. It's a much, much different climate.
Sure does paint the picture there of what you're dealing with. Before we let you go, Dr. Alexander, is there anything else that you'd like to say to the public?
I thank everybody, the communities, for coming together, for really understanding what these stay-at-home orders mean, for really practicing social distancing. I thank you all for doing that, because you're protecting everybody around you, your entire community, including the healthcare workers who are trying to serve you. I thank you for that. Remember, social distancing does not mean that you have to stay away from folks in regards to getting on the phone, having a virtual meeting, virtually FaceTiming somebody on a Friday night to hang out. Maybe we should change it to physical or spatial distancing, because the social thing has gotten a little bit taken out of whack. But just reach out to each other, stay connected, stay well, and stay safe.
All right, you too, Dr. Christie Alexander, thank you so much for being here.
Thank you.
And we will check in with you again soon as we get, of course, more questions. And thank you so much for always answering them.
That's right. Okay, you can always go to our website to watch all of our previous coronavirus segments with Dr. Christie Alexander. She's appeared on the show 4 times over the last few weeks.